Cold out here. Hey guys, thanks for stopping in. My video today, I was thinking I probably know more about chronic pain than most doctors do. And I'm not saying that to be arrogant. I'm just saying that because I'm 55 and I've had chronic pain since I was like 17 or 18 due to thoracic outlet syndrome, lower back pain. I've had 3 back surgeries. On and on. I've had open heart surgery, but what got me thinking about that was in the comments. I was just replying to comments on some of my videos, and someone said, well, my doctor had to Google my symptoms. He didn't know what it was, and he said, you know, they're not a walking encyclopedia. They're just a human being, so a lot of times they don't know any more than we do, and he's exactly right. You know, if doctors are not familiar with a certain, you know, condition or illness or whatever, they really don't, you know much about it. All they know is, you know, maybe what they learned in a book. And like when it comes to thoracic outlet syndrome, what I have, a lot of doctors have never even heard of that. So, you know, and you know what you have to think too, or realize, being a doctor is a business. So, you know, they have to tell you something. The frustrating part for us as a chronic pain patient is, you know, you wait sometimes a couple months to get an appointment with a doctor, and you go in there and they just sort of look at you. You're in there for a few minutes and they don't know what to do, and they basically try to prescribe you something. And in my case, a lot of times I'd say, well, you know, I already tried that. Oh, well, you know, maybe you didn't try it for long enough, or maybe you didn't take the right dosage, or, you know, and it's like, no, it just didn't work. But they don't want to hear that. Oh, well, just try it again, you know, and come back and see me, you know, in a month. And, you know, that kind of thing is so frustrating. But, you know, when you think about it, from their standpoint, they have to tell you something. They see a certain amount of, you know, people in a day. They see you for a few minutes. They have to tell you something. But when you're the chronic pain patient and you're in pain and you've been waiting all this time, that's not what you want to hear. You want to hear, okay, I know what's wrong with you. Here's how we fix that. But unfortunately, that's not the case most of the time. So, and the thing is, people rely on doctors, and I think nowadays with the internet, if you can start doing research and figuring out things on your own and not relying on doctors so much, you're probably better off, because there's some things a doctor just can't fix anyway. When it comes to chronic pain, I like a good example. I go to my doctor and like I do the vacuum cupping, and he really didn't know what that was. He wasn't familiar with that. Or he'd say, oh, you know, what else do you do to manage your pain? Oh, joint mobility exercises. So you mean like stretching? He didn't know what that is. So a lot of these alternative, you know, therapies and things like that, a lot of doctors just don't know what that stuff is. Doctors know what they know, what they're trained in. So if they haven't, you know, seen certain conditions, they don't know anything about it. So like someone like me that's dealt with chronic pain for pretty much my whole adult life, I mean, I know what works and doesn't work for me. Doesn't mean I know what'll work for somebody else, but a lot of the things that I do will help some people, not everybody, but some people. So, you know, in that case, you know, I do know a lot about it, and also I get how it is to live with it and deal with it. That's what I think I understand. I get a lot of comments on my videos lately, and people seem to vent, and you know, they need someone to vent to someone who actually understands what they're talking about, because that's the problem is people that don't have chronic pain, they just don't get it. So you'll tell, you know, your family, your friends, this and that, and they're just like, you know, they're just like, yeah, whatever. So, you know, and until they have it themselves, then it's a big deal. I've had people, oh, you know, they'd hurt their back or something. Then they start coming and asking me questions, and then they're like, oh gosh, I don't know how you deal with this all the time. It's like, yeah, well, yeah, it's like, you know, I don't just like complain for no reason, and most people with chronic pain don't. It's just like nobody gets it, nobody understands. So anyway, that's my video for today. Thanks for watching, and I'll talk to you guys next time.